so when it comes to Addison's disease, so the issues here are, number one, whether these people are more vulnerable to develop COVID or not. But the overarching consensus is that they probably not belong to the group that needs to be shielded, like the people who are immunosuppressed, because here the steroid replacement is physiological rather than increased dose. And the second thing is that what should be done to prevent adrenal crisis, so in these people. So conventionally, what we used to say was when people who are on a steroid replacement for Addison's disease, so which is usually a hydrocortisone given in 2 or 3 split doses, or prednisone given as usually one daily, once daily single dose. In addition, giving mineralocorticoid replacement in the form of hydrocortisone. But there are some anecdotal data that showed that people who get admitted to COVID in the hospital, so their steroid levels are much higher. And then this conventional plan where people, when they become unwell, so they were asked to double the dose of medication that they were on. So if you're on hydrocortisone 10, 5, and 5 milligrams, then you'd ask them to increase it 20, 10, and 10. So for the duration of the illness and for say 2 or 3 days following the recovery. And if they're on prednisone, you just say double the dose for the duration of illness and for a couple of days after. So the consensus from the Society of Endocrinology, at least in the UK, is that so that's probably, it may not be sufficient in people with Addisons, especially if they've got COVID-related illness. So the recommendation now is that, so number one, so try to avoid risk of exposure to COVID as much as possible. So number two, try to take 20 milligrams of hydrocortisone 4 times a day, so that which would give you those individuals a higher level of hydrocortisone or steroid in their blood for a 24-hour period rather than having peaks and troughs. And if they're on prednisone, if they're on a smaller dose, then doubling would be sufficient. But if they're on a higher dose, more than so 15 milligrams, so the recommendation is that they need to take it at least twice daily so that they have there's no peak and trough, but they'll have a sufficiently higher amount of steroids in them. So about 10 milligrams of prednisone twice daily is recommended. So please refer to the recommendation of Society of Endocrinology, which are available in detail on websites and widely available. So the second thing is that if people are not able to take medications orally, so if they have their EpiPen or hydrocortisone injection on hand, so that they can take it as quickly as possible rather than delaying it. And in people who are hospitalized due to severe COVID, the recommendation is that for them to have hydrocortisone as intermittent bolus doses of 50 milligrams given every 6 hours, either intravenously or intramuscularly. But where possible, the recommended option is to give hydrocortisone as a continuous infusion. That will ensure a higher level of steroids that's available in their system throughout the 24 hours. Yeah, so those are the recommendations for that. So again, the safest way is to reduce the risk of exposure and prevention. And if they get illness, so their increase in the dose of hydrocortisone or prednisone, so it's much more so than the conventional sick day rules. So that we usually advocate. And for those people who are on hydrocortisone, so the recommendation is to carry on taking the same dose of hydrocortisone as before.